We're being joined now by Dr. Bennett Greenspan. Congratulations on nearing the end of your term as the SNMMI president. Now, what themes or research at this year's meeting most excite you?
Well, in terms of themes, the major one is we've started this value initiative to highlight the value of nuclear medicine in clinical practice to clinicians, including radiologists, patients, the public, regulators, and so on, because nuclear medicine provides tremendous value in patient care if used well, and so that's an important feature. As far as research, one of the major issues now is we're having great strides in evaluating and then treating prostate cancer, and we've got new agents to image prostate cancer and determine its extent and severity, and then we can actually treat it now with a radionuclide therapy, and we're having some great success with that.
And recently there have been some new developments with regards to thyroid cancer. Can you tell me about that?
Yes, thyroid cancer, you would think is pretty straightforward in terms of treatment. You know, we use I-131 and it works for differentiated thyroid cancer. However, there actually is a lot of controversy, and many people have different opinions on how to treat it. And much of that is from the way they were trained, and things are different in different places. And so we've actually joined with 3 other societies, the European Association of Nuclear Medicine, the American Thyroid Association, and the European Thyroid Association, to try to come to a consensus on some of the issues. And we've established a very collegial and collaborative working arrangement with all 3 societies, and we're making some progress.
There have been some interesting discussions recently with regards to LNT. Can you tell me about that?
Yes, LNT stands for linear no threshold hypothesis. It's what's been used in our field for a number of years, mainly for radiation protection purposes. People say it's prudent to use this so that we minimize the risk of radiation to patients. Well, it turns out that LNT is actually wrong. The evidence, from what I can see so far, there's a lot of evidence against it, and there's virtually no evidence for it. And to use it in radiation protection actually is actually not even prudent. And the best example of that is what happened at Fukushima. The Japanese authorities, with the best of intentions, and following the advice of professionals in our country as well as theirs, evacuated 150,000 people after that horrible accident, you know, the earthquake and the tsunami, to avoid radiation exposure to so many of their people. And 1,600 people died due to that evacuation. Many of them elderly, many of them because they were away from their homes, or away from medical care, or away from their families. Those are real deaths. And in reality, how many would have died from radiation exposure? Probably none. The LNT hypothesis would have predicted 160 to 640 or something like that. That's in 20 to 30 years. But again, I think LNT markedly overestimates the risks. I think the real risk was close to 0. And so this needs to be looked at carefully. And I'm just starting a committee now within the society, with some collaborative societies, to look at this issue very carefully. And we're going to look at the evidence thoroughly and hopefully come to a conclusion, and then we're going to publish the results.
What do you think will be the big trends with nuclear medicine and molecular imaging in the coming year?
Well, I think the biggest one is radionuclide therapy, also known as radiopharmaceutical therapy. These techniques have a tremendous potential to provide better outcomes for patients with far less morbidity. And we're just starting to see this now, mainly in prostate cancer of all things, which has been very difficult for us to manage until very recently. And now we have newer agents to image prostate cancer. We can tell the extent of disease, and we just had one of the therapy agents approved in the U.S. in January, and the Australians are actually way ahead of us, and they're showing that with some of their agents that they can provide fantastic results in patients with advanced prostate cancer. And so clearly that's a real key. We're going to be able to do this with other cancers as well.
Dr. Greenspan, thank you so much for joining us.
Thank you very much. I enjoyed it.